Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope you're well. Hope this informs you and makes you potentially even better. We here at Longevity Health Institute look at you in a functional, integrative way, and we always consider hormones. And I've been kind of accused lately of not talking enough on my channel and on Facebook, etc., about hormone balancing, replacement, etc. So I want to give you some insight into why we really look at and appreciate hormonal effects in the body. So here's birth, here's death. We're all going that way. Now, yes, it sounds negative, hopefully not too morbid, but it's realistic. So if birth is here and here is 100 years old, or whatever our goal is for longevity, we want to thrive and not just survive. We want to be highly functional. We want to have our memory, our mind, our structural integrity to walk and get around and see loved ones and enjoy the outdoors and meet people and socialize and interact, because that is living and that is quality of life. And that's what we're all about here. Prevention and quality of life. That's what longevity is, right? So you have to appreciate hormones. So if we're going towards the spectrum and down the stream of things like, unfortunately, potentially, down towards cancer. As we age, cancer gets more and more risks elevate. In fact, actually, over the age of 55, the incidence of cancer, and all types considered, is more than doubled. Okay, so as you age, your cancer risks go up. Also, as you age, your risks of bone loss and structural changes, osteopenia, osteoporosis, degenerative changes, they go up with aging, of course. We also see more incidents of cardiovascular events and cardiovascular disease. These, of course, go up with aging, particularly after men in andropause, which is male hormonal decline, and women in menopause or perimenopause, which is female sex hormone decline. So these all go up with aging. The other thing is that what also happens besides cancer and structural issues, bone health and that, okay, like osteoporosis, is cognitive decline. Cognitive decline happens as we age, of course. And why does that happen? Well, it happens because we don't basically clear debris from our brain. We don't have good senescence, essentially, and we develop potentially amyloid plaques and tau proteins and things. Or let's just say we get microvascular changes to the brain. And all of these things happen. Why? Because of aging and things that also are affected. Now, what the studies show is, and the data shows, whether it's a true functional medical study or it's a evidence-based raw scientific study, and some, yes, on animals, but that show us that if you're trying to prevent decline in cognition, decline in cardiovascular events, decline in your immune system, meaning cancer, okay, you have to aggressively appreciate hormonal decline with aging, okay? Whether that's thyroid, whether that's your adrenal hormones, whether that's your insulin sensitivity and pre-diabetes, whether that's low testosterone in a man, whether that's menopause in a woman, whether that's perimenopause, whether that's in your 70s or 80s, guaranteed significantly low growth hormone, but we assess in your 40s and 50s and want to look at those metrics as you age. But again, this is what prevention is appreciating and optimizing and balancing appropriately the right hormones in the right successive way. And this is what we create here at Longevity Health Institute, is a foundation of your health, including that structural foundation of hormones. So key things to appreciate when you're trying to prevent dementia, prevent diabetes, prevent cardiovascular disease, prevent dementia, prevent osteoporosis, you can't ignore hormones. And when you do, whether your head's in the ground in the sand, like they say, or you're just going to live in fear controls everything, you're going to miss the opportunity to literally prevent these and optimize your quality of life. So I'm reading a wonderful book right now about women and cognitive changes, and how the dementia rates are almost double in women postmenopausal compared to men. And one of the key features is this: you don't want to lose that estrogen window of prevention in menopause, meaning in your 50s or very early 50s, so late 40s, early 50s. You don't want to wait till you're 60 and 70 to really appreciate the loss of estrogen and the negative effects that it can have. Okay, you want to be looking at that in your 40s and on and using it, and that's what we do here, is in a balanced integrative approach. So here at Longevity Health Institute, me and my practitioners, are passionate about that, is really optimizing your quality of hormones and your balanced amount of hormones appropriately. And we use scientific, natural, yes, but approaches to evidence-based hormone replacement and looking at all your hormones in the right appropriate way. So hopefully that gives you some insight into longevity and prevention related to hormones, and whether you think it's going to happen or not, it's happening. It's just a matter of what hormone is declining first and how rapidly and how significantly for you in a personalized way is it showing up. Okay, not everybody needs every hormone replaced. Do not hear me wrong. Okay, but you need to at least evaluate them, draw the labs, look at the reasons and things that we would optimize and replace these in a natural, appropriate way, so that you can prevent these chronic diseases that are coming if we're blessed long enough to live that long. So hopefully this gives you some insight, hopefully making a positive spin on this, not so, birth to death talk, but to thrive, to really enjoy life, to literally be successful in business and in your family and in Christ and in spirituality and with your loved ones, and to have good intention and good relationships and really make a difference in the world. You have to be well, you have to be optimal, okay? You need hormones to be optimal to actually perform at that level. This is Dr. Lewerenz. Share with others. Please subscribe to my YouTube channel. I'm trying to bring you the best in integrative, functional, personalized medicine and training other practitioners in improving the quality of life for all. This is Dr. Lewerenz. Be well. Enjoy.